Hello and welcome to the 1-month class after bariatric surgery. My name is Vanessa and I'm a registered dietitian from the Bariatric Clinic at Humber River Hospital. Thank you for joining us today. Please feel free to rewatch this video as much as you need. If you have additional questions after watching this video, you can contact the clinic. You can pause the video at any time to take notes. Please see the description below for the links to the book and the videos that I refer to. Today's presentation will review weight loss expectations after bariatric surgery, reasons for weight fluctuations, and weight loss plateaus. I will discuss how to introduce solid foods and discuss eating techniques to improve food tolerance. I will discuss what and how much to eat. I will discuss the importance of protein. I will review common nutrition problems and how to prevent them. Lastly, I will discuss how to stay on track with weight loss goals and how to safely introduce physical activity. All of the material I will review is in the resource book. You can purchase a printed copy of the book at the clinic or download a copy from the link provided. There are also a number of short videos on specific topics if you follow the link. The presentation highlights the information between pages 48 and 79 of the resource book. Everyone is interested to know how much weight they will lose after bariatric surgery. Please know that a number of things can affect your weight loss, including genetics, age, activity level, your biological sex, and the type of surgery you had. Avoid comparing your weight loss to that of other bariatric patients because everyone responds differently to bariatric surgery. On average, patients lose 3 to 5 pounds per week or 10 to 15 pounds per month in the first 6 months after surgery. The majority of your weight will be lost during these first 6 months. Afterwards, your weight will slow down and stabilize around 12 months. Many people expect to lose more weight than is realistic. Therefore, we do not recommend setting a weight loss goal number. Having unrealistic expectations may bring up negative emotions when that goal is not met. You cannot fully control how much weight you lose after bariatric surgery. You will likely still have obesity following bariatric surgery, but you will have less obesity and will hopefully enjoy the many possible health and lifestyle benefits of your weight loss. It is important to understand what your best weight is. Doctors Yoni Friedhoff and Arya Sharma define best weight as the healthiest lifestyle a patient can realistically enjoy, not the healthiest lifestyle a patient can tolerate. There comes a point when a patient cannot eat less or exercise more and still like their life. The weight they attain while still liking their life is therefore their best weight. There are a number of reasons why your weight might fluctuate day to day. Depending on whether you ate or drank before stepping on the scale, the time of day when you weigh yourself, the last time you had a bowel movement, weighing yourself on different scales, hormonal changes related to your period, or retaining fluid due to high blood pressure or other health conditions. We recommend weighing yourself no more than once a week so you can see your overall trend. You can become addicted to checking the scale, which is not healthy. There will be times where you lose inches off your waist instead of pounds or kilos. During the first few months after weight loss surgery, you may notice your weight stop or stall for a few days or weeks. We call this a weight loss plateau. A plateau can happen because your body is adjusting to the rapid weight loss and the major surgery that you had. After a plateau, you may have a period of rapid weight loss. If your weight has been stuck for 4 or more weeks during the first 6 months after surgery, then you may need to reassess the situation. Keep in mind that you might still be losing inches off your waist or gaining muscle. Other contributors to weight loss plateaus include inadequate protein intake, inadequate physical activity, or your food choices. As you're introducing solid food, there are a few things to keep in mind. You will likely not have an appetite for many months following the surgery. Please set timers or reminders to remind you to eat on a schedule. You will need to follow a meal routine even if you don't feel physically hungry. It can take several months before you're able to tolerate a variety of foods and textures. Generally speaking, your tolerance will improve with time. We recommend that you introduce one new food at a time so that if you do have trouble, you can go back and figure out what caused your stomach upset. Following proper eating and cooking techniques will improve your food tolerance. Cooking with minimal amounts of fat and sugar will also keep dumping syndrome at bay and improve your food tolerance. The goal here is to eat 3 well-balanced meals plus 1 to 2 snacks every day. Aim for 70 to 100 grams of protein every day. Remember that protein shakes are required for the first 3 months after surgery to help you reach these goals. We recommend that you start your meal by eating your protein food first, followed by your vegetables, and then your starch if there's still room. When you have reached diet stage 5, soft solid foods, these are the next foods to try. Hit pause to read them slowly. Look for lean proteins that are braised, boiled, or steamed. Cook vegetables well at first, then slowly try incorporating firmer vegetables by stir-frying or cooking them less. Once firm vegetables sit well, you can try raw vegetables like cucumbers and tomatoes. Salads will be the last stage. Fruits and vegetables are better tolerated without the skin at first. Start with soft fruit cups and progress to firmer fruit. Eventually, you can add the skin and seeds back in. Grains and starches are last. Toasted and thin slices of breads are better tolerated. After most of the foods you have introduced are going well, you can try pasta and rice. Overcook these the first time you make them and try a short pasta like macaroni. It might take about 2 months to get to the point where you can tolerate things like raw vegetables and salads, raw fruits, toasted bread, whole wheat pastas and rice, as well as red meats. This slide shows a number of challenging foods and textures. Meats can be difficult when they are dry or cooked in too much oil. Some cuts of meat can be too tough due to the connective tissue, so look for alternatives. Fruit skins can be tough at first also, so we recommend peeling apples at first. Fruit juice provides quick access to sugar, which can cause dumping syndrome, so it is not recommended. Dried fruit can also contain high amounts of sugar if eaten in large quantities. Keep portions to 1/4 of a cup and chew well. Breads, bagels, rice, and pasta can be very dense. They tend to sit heavy in your pouch after surgery. Keep portions to 1/4 of a cup and toast your breads. Pastas and rices can be overcooked to go down easier. Sweets and sugary foods can lead to dumping syndrome and slow down your weight loss. Fibrous vegetables like celery and asparagus can be peeled to make them easier to digest. Cooking them more thoroughly will also make them softer. Continuing to chew well will also help significantly. Continue to avoid carbonated beverages. The bubbles can be very painful or stretch your pouch. Nuts and seeds should be kept to about 1/4 of a cup as they can be high in fat. Sugar alcohols will be more common if you purchase sugar-free foods, which can lead to loose stools in high amounts whether you've had bariatric surgery or not. Highly spiced and seasoned foods may also take some time to get back to. If you were never a spicy eater, I don't imagine it will start to sit well now. Now we will move on to meal routines. You should aim to have your first meal within 90 minutes of waking up in the morning. Food should be a priority if you want to maintain your weight long term, and this is the first step. Your lunch and dinner should fall 4 to 5 hours after each meal. Snacks are recommended to help you reach your protein, fluid, and fiber goals. If your meals go longer than 5 hours, definitely fit in a high-protein snack midway between your meals. Your meal routine should fit your own schedule and may not be the same as everyone else. Here are 2 different schedules, one for someone who works days and one for someone who works nights. Notice that the first meal is within 90 minutes of waking up. Meals are 4 to 5 hours apart, and if they're longer, there's a snack built in. If you work nights, we expect you to eat while you are awake. If you don't, you may become malnourished or have low blood sugars. Here are some techniques that will make eating go smoother. Take your time eating. Meals should take 30 to 60 minutes. Pay attention to your feelings of hunger and fullness. It may take time to learn to stop eating when you are satisfied versus when you are stuffed. We don't want you eating to the point of discomfort. This can only be done if you are being mindful with your eating. The feelings may be different from before surgery. Common feelings of fullness include runny nose, hiccups, and pain under the ribcage. Avoid distractions during meals like screens or working through lunch. The distractions can lead to less well-chewed food. Remember to include a 30-minute buffer between eating and drinking. Drinking too closely to eating can cause feelings of fullness, and drinking too quickly after meals can lead to dumping syndrome by washing the undigested food into your small intestine. Cut food into small pieces. This makes each bite easier to chew and break down. Putting your fork down between bites also slows you down. Measure your food so you are conscious of the portion sizes you are eating. Not measuring can lead to growing food portions and weight regain. Fluids are better tolerated when you sip them slowly instead of having large gulps. Find the link for the eating techniques video in the description below. Dry foods are not well tolerated after surgery because your new pouch doesn't have the same fluids and power to break down your meals. Cooking foods in a moist manner will help the foods break down easier. Moist cooking methods include boiling, simmering, poaching, braising, slow cooking, and pressure cooking. Cook your foods in different liquids including water, broth, low-fat gravy, or low-sodium tomato juice. Low-fat and low-sugar sauces can also be added afterwards to add moisture to foods. Microwaving, grilling, and frying can dry out foods, making them more difficult to eat. There's a link to a video about moist cooking in the description. Moving on to portion sizes. Between months 1 and 3, your portions at meals will be about 1 to 2 ounces of protein, 1/4 cup of vegetables, and about 2 tablespoons of starch. In total, this is about a half a cup of food or 4 ounces of food. Snacks include protein shakes or about 1 ounce of protein and half a cup of fruit. As we move forward to 3 to 6 months after surgery, your portion sizes grow to about 3/4 of a cup or 6 ounces of food total. Meals include 2 to 3 ounces of protein, about the size of a deck of cards or the palm of your hand. On the side, about 1/4 to 1/2 cup of vegetables and 2 to 4 tablespoons of starch. Snacks don't have to be protein shakes anymore as long as you're meeting your minimum protein goal of 70 grams. This is an example of a meal at 6 months. This may look like a lot of food right now, but this is what you are working towards. This is the sample menu for 1 day of eating. Hit pause to read through it. These next 3 slides were taken from Lisa Kauk and Monica Bashaw's book, The Complete Guide to Weight Loss Surgery. They are 2 registered dietitians that used to work in a bariatric clinic in Ottawa. Water can be difficult to tolerate after surgery and feel like swallowing a rock. Try warming the water or adding sugar-free flavors like Crystal Light or Mio. Decaf tea or coffee can also count towards your hydration. Small sips are key. Breads can feel like a dense dough ball. Try toasting it or cutting thin slices. Flatbreads like tortillas can also be better tolerated. You can also try gluten-free breads because they will be less gummy. Pastas and rice, similar to breads, can also feel really dense in your pouch. Try whole grain or gluten-free pasta. Again, they will feel less gummy. Smaller pastas like macaroni will sit better than a long spaghetti. Overcooking your pastas and rices will add more moisture and make them softer. Meat and fish can be difficult if they are tough cuts or cooked too dry. Use moist cooking methods or add sauces to the meat. You can tenderize tough cuts of meat by pounding it, braising it for extended periods of time, or adding meat tenderizer. Avoid using a microwave to reheat meat as it can dry out. Eggs are very hit or miss, and don't be discouraged if they don't sit well. Try soft boiling the egg where the yolk is more runny. Egg salad with mayo or an omelet where the egg is mixed in with other foods can also sit better. If both of these don't sit well, try just having egg whites. Raw vegetables and fruits will take some time to work up to. Peel the skins and cook them down to make them easier to digest. Some stringy or tough fruits and vegetables can also be cut into small pieces. Take your time and chew these foods extra well. This is a picture of the book where these recommendations are from. If you are having trouble with foods, walk through these questions to determine whether you are following the eating techniques properly or if you need to seek medical attention. Take a moment to read these questions. You can also hit pause to take a screenshot or write them down. You are following the recommended guidelines correctly if you have answered yes to all of the above questions. In this case, there may be other reasons why you're experiencing problems and should seek attention from your healthcare team. Protein is a critical part of healthy eating and your weight management journey. Protein is needed for wound healing, maintaining muscle, keeping cravings in check, limiting hair loss, and avoiding low energy. Every day, we recommend that you aim for 70 to 100 grams of protein. You can reach this goal through a combination of protein shakes and protein-rich foods. We recommend that you have at least one protein shake every day for the first 3 months. After 3 months, you may be able to meet your protein goals simply through food, at which point you can discontinue your protein shake. The criteria for our protein shakes are on this slide. We recommend a protein powder made from whey isolate. Look for a shake that contains 20 to 40 grams of protein, 0 to 5 grams of carbohydrates, and less than 200 calories per serving. The shakes can be whatever flavor you enjoy. Typically, they are mixed with water, but can also be mixed with skim milk. A popular brand our patients enjoy is Premier Protein, shown here. If you have intolerances to whey or dislike the shake you found, try other ones or speak to your registered dietitian for more ideas. Other ways to increase your protein intake would be to add unflavored protein powder or skim milk powder to foods. Boost Just Protein can be found at major drugstores. Skim milk powder can be found at grocery stores and bulk stores. Some of you may have also heard of Joya or Fairlife milk, which are higher protein cow's milk that can be found in the milk section of the grocery store. This chart shows the protein content of a portion of protein-rich foods. A more extensive list can be found on page 84. Typically, protein-rich foods include meats such as beef, pork, chicken, and fish, dairy products, eggs, and legumes or beans. Be careful with milk alternatives as they may be low in protein, such as almond milk. If you are lactose intolerant, try Fairlife milk, which is lactose-free, or soy milk. Always check the label for specific protein amounts if available. If you would like to know more about protein intake, please follow the link in the description below for our protein video. These are some common nutrition problems after bariatric surgery, and we will go into each one in more detail. Vitamin and mineral deficiencies are caused by eating smaller amounts of food and decreased absorption of nutrients after surgery. For the first 3 months after surgery, we recommend chewable, liquid, or crushed supplements and medications. Also, remember to take your Prevacid first thing when you wake up because you need to wait 30 minutes before eating breakfast. You should also take it by itself. Prevacid is recommended for the first 6 months after surgery. Speak to your nurse if you have other questions about medications. Here are the recommended doses for your vitamins unless the nurse or internist has recommended something specific for you. Please double check that you are taking the right doses. Take 1 multivitamin tablet twice per day. Double check that it has iron, folic acid, selenium, copper, and zinc. Avoid time release, gummy, men's, and children's vitamins because they are not appropriate. Aim for 1,500 milligrams of calcium every day, divided into 2 to 3 doses. Calcium citrate is best absorbed. Aim for 500 micrograms of vitamin B12 daily. You may find higher doses of vitamin B12 such as 1,000 micrograms. If that is the case, take it every other day. You can also take a monthly B12 injection with your family physician. Aim for 3,000 international units of vitamin D daily. Pair your calcium with your vitamin D because they work together. Depending on your individual blood work results, you may need additional supplementation such as iron, zinc, vitamin A, or vitamin C. You do not need to take these unless instructed to do so. Click on the link in the description to find our detailed vitamin and mineral video. Here are 2 sample vitamin schedules to keep you organized. You can see here that we spread the supplements throughout the day to maximize the absorption. Avoid taking calcium within 2 hours of your multivitamin and iron, as they can compete for absorption. If you do need to take iron, we typically recommend taking it at the end of the day, as it can be hard on your stomach. A number of reasons can contribute to nausea, vomiting, and stomach pain, including eating too much, eating too fast, not chewing enough, eating dry or tough foods, taking large bites, eating and drinking at the same time, swallowing air, dehydration, erratic eating schedules, extreme temperatures, and eating difficult textures. Return to the eating techniques to help you troubleshoot these issues. Hit pause if you need to read this slide. If you're experiencing gas or bloating, it could be caused by drinking or eating too fast, having carbonated beverages, eating gas-forming foods, using straws, chewing gum, or having sugar alcohols. Try the tips listed here if you are able to identify the trigger for gas and bloating. If you still continue to have gas and bloating, try going for walks to move the gas along. Some medications that may provide relief include Lactaid, Beano, or Gas-X that you can purchase over the counter. Dumping syndrome is a result of undigested food being emptied into the jejunum, or small intestine, too quickly. Remember, before surgery, your stomach had a pyloric sphincter that would control the release of food slowly into your small intestine. Now, you will have to manage how quickly and what kinds of food travel from your pouch to your jejunum. You can manage dumping syndrome by choosing lower fat and lower sugar foods and avoiding drinking while eating. Symptoms of dumping syndrome include blurred vision, weakness, diarrhea, abdominal pain, nausea, vomiting, palpitations, flushing, and reactive hypoglycemia. Dumping syndrome doesn't affect everyone. It occurs in approximately 50 to 70% of gastric bypass patients and is less common in the gastric sleeve. Follow the link in the description for a more detailed video about dumping syndrome. We can determine if a food is low in fat or sugar by reading the food label. First, we need to determine what the serving size for the food is. If you are having less than this serving size, you will need to adjust the contents accordingly. Look at the percent daily value column. 5% or less is a small source of that nutrient, whereas 15% or more is a good source of that nutrient. Look for 5% or 3 grams of fat or less. Look for 10 grams of sugar or less on a food label. The food label here shows that this food is too high in sugar and would probably cause dumping. If you were to cut this food in half and only have half a cup, then it would have 1 gram of fat and 8 grams of sugar, which should not lead to dumping syndrome. If there are no nutrition facts table available, then look at the list of ingredients. If sugar is listed as one of the first 3 ingredients, you should avoid this food. To prevent malnutrition after bariatric surgery, it's a lot of the same principles that we've already discussed. Getting in a variety of foods and nutrients by following eating techniques, following a meal routine, meeting protein goals, and taking in your supplements. You may notice your bowel pattern changes after surgery. You are eating a lot less food and may have different amounts of fluid and fiber after surgery. A normal bowel movement is soft, formed, and easy to pass every 1 to 3 days. Constipation is defined by hard or dry stools that are difficult or painful to pass. Some reasons for constipation after surgery could be inadequate fiber, inadequate fluid, certain pain medications, iron supplements, and bowel disorders. Make sure you're having at least 1/4 cup of vegetables twice daily at meal times and at least 1.5 to 2 liters of water daily. You can try inulin fiber supplements such as Benefiber or Fiberific every day. You will need to take fiber regularly to see the benefits. If you are on iron supplements, you may feel stomach upset and constipation. There may be some forms of iron that are easier on your stomach than others, so chat with the team about your options. Get moving, because regular walking and activity keeps the bowel muscles pushing stools along. If you have not had a bowel movement after 2 to 3 days, you can try Senecot S, Milk of Magnesia, or Restorelax as listed here. If you still don't have any luck, try a suppository or fleet enema, or call the nurse for additional support. To stay hydrated and avoid constipation, aim for 1.5 to 2 liters of fluids that do not have calories, carbonation, or caffeine. Water is the best choice. Aim for about 1 to 2 cups of water in between each meal. You can use flavor enhancers like sugar-free Crystal Light, Mio, fruit slices, or mint in your water. You may need more than 2 liters of water if you are very active, sweat excessively, are vomiting, or having diarrhea. A stricture occurs when the small opening between your pouch and small intestine is too tight. Food, fluid, vitamins, and medications will have a hard time passing through, and you may notice a white, sticky, foamy vomit or spit up. If you think you have a stricture, please contact your surgeon and they may do a scope to see what is going on. Low blood sugars can happen after bariatric surgery, even if you were not a diabetic before surgery. If you do not treat it immediately, it could turn into a medical emergency because you could lose consciousness. A low blood sugar is 4.0 millimoles per liter or less. Some symptoms to look out for include feeling shaky, dizzy, sweaty, weak, hungry, hangry, a headache, or upset. A low blood sugar is caused by skipping meals, not eating on time, not eating enough, doing excessive activity without eating, drinking alcohol, or taking too much diabetes medication. Stick to your meal routine and avoid going longer than 4 to 5 hours between meals. Plan snacks if you need to between meals and before vigorous physical activity. Include both protein and high-fiber carbohydrates at your meals and snacks. Talk to your family physician and bariatric team if signs and symptoms continue. For the health of your baby, we do not recommend getting pregnant within the first 2 years after bariatric surgery. Generally speaking, you may become more fertile with the weight loss and change in hormones. For that reason, we recommend non-oral methods of birth control. Please speak with your family physician about your options. Your gastrointestinal tract is adjusting to the change in nutrient intake, and you may have nutritional deficiencies that impact your baby. You are in a much better position if you support a healthy baby when your weight is stable after 2 years. If you do become pregnant after surgery, we recommend that you make a drop-in visit with the nurse and dietitian so we can provide education. We recommend avoiding alcohol for the first year after bariatric surgery. This is due to the fact that you metabolize alcohol differently after surgery and absorb alcohol faster. This means you may feel the effect of alcohol sooner, even with a small amount. It will also take longer to clear alcohol from your body afterwards. You are also at risk for developing alcohol use disorder or a dependency on alcohol. You could also have ulcers, dumping syndrome, poor decision-making, and low blood sugars. Alcohol intake can also contribute to poor weight loss or weight regain. Finally, we will discuss strategies for long-term weight management. We cannot emphasize enough the importance of measuring your food and following a meal routine. Plan and make time for your meals and snacks. Skipping or delaying meals can lead to overeating because you are overly hungry at that time. With time, you will get better at knowing what portions work for you, but without calibrating your measurements regularly, they can increase without you noticing. Meal planning helps you stick to healthy food decisions when you have a busy lifestyle. Planning helps prevent making poor last-minute meal decisions. When you plan your meals, you can also plan your groceries so everything is smooth and food waste is minimized. We recommend creating a plan at least 2 to 3 days in advance. Keep a list of quick, well-balanced meals and snacks that you enjoy and can tolerate well. Refer to our meal planning video in the description for more specific tips. Eating food from outside of the home will generally lead to more calories, which is why we recommend limiting eating food from restaurants, takeout, and delivery to 0 to 3 times per month. Outside food usually is higher in portion, fat, sugar, sodium, and cholesterol. If you're having difficulty tolerating new foods, restaurant foods are going to be harder to control and possibly lead to more issues. Make an effort to pack meals and bring them to work or school. When you do eat out, plan your meal ahead of time by looking at the menu online and speak to your server about adjusting your meals to your needs. Try these tips to manage calories and maximizing easy to tolerate foods when eating out. Ask that bread and butter not be served at your table. Choose a meal with lean protein. Choose a complex carbohydrate and vegetable as your sides. Ask the server how the food is prepared and avoid items that are fried or breaded. Food that is baked, broiled, grilled, and roasted will be lower in fat. If you have problems with grilled foods, ask if they can steam it for you. Avoid choosing items from the kids' menu because the choices are often high in fat and fried. Share your meal with others that you're dining with or take part of your meal home. There are many reasons that we eat, including physical hunger, emotional reasons for comfort, out of boredom, or when we are triggered by the environment such as commercials, sights, or smells. Bariatric surgery can help you manage your physical hunger, but you will need to manage your emotions, mindless eating, and your environment. The better you are at recognizing why you are hungry, the better you can figure out how to address your hunger. You have to remember the surgery is on your stomach and not your brain. Eating regular, balanced meals will also minimize our feelings of hunger. When you're feeling like eating out of comfort or boredom, try some distraction strategies or drink some water. Some distraction strategies include shifting your thinking, like thinking about a dream vacation, thinking about one vegetable for each letter of the alphabet, or counting to 10 in a language you don't know well. You can change your setting by watering your plants, brushing your teeth in the bathroom, going for a walk, or just changing activities. You could do a crossword puzzle, garden, read a book, listen to some music, or call a friend. If you have tried to distract yourself and you are still hungry after 30 minutes, and it's been close to 2 hours since your last meal, go and have a protein-based snack. After bariatric surgery, your body may look and feel different than you had imagined. It may take time to get used to a different body shape and size. Be patient and you will adjust to these new feelings. Loose skin is a reality for many people who lose a significant amount of weight. Your bariatric team will give you information on skin removal surgery and/or discuss ways to accept loose skin as part of your weight loss journey. People may tell you your weight and your looks have changed, but you may not see it yourself. Take pictures of yourself at some point before your surgery and then regularly until you reach your best weight. It's a good way to help you manage your self-perception. You might not be prepared for the attention you receive from your family, friends, and coworkers. It is normal for people to notice change in your weight. Weight loss is highly valued in our culture, so most people are trying to be kind when they make comments. It is important to think about how this makes you feel, as some people enjoy the attention and others do not. Either way, it may be helpful to come up with a response so you are prepared for the attention. For example, saying "Thank you, I'm enjoying how much easier it is to get in and out of the car," acknowledges their attention, yet focuses on improvement in movement instead of the amount of weight you have lost. Start walking as tolerated to a goal of 30 to 45 minutes per day. If all you can manage right now is 10 minutes, that's great, keep at it. It will get easier as more weight is lost. Increase your physical activity as tolerated when your surgeon gives you the okay. We do have a kinesiologist available on our team for tailored exercise tips. If you're interested in a referral, let our team know or call the clerks to book you in with a kinesiologist. Get in touch with your surgeon if you are having frequent vomiting, worsening food and fluid intolerance, persistent pain, or chronic nausea despite following eating techniques. If you feel like you are following all of the recommendations and still struggling, reach out to your surgeon. You should have a follow-up at 3 to 4 weeks post-op with a surgeon if you haven't already. Your next appointment with them is at 3 months. Your next visit at the clinic will be at 3 months post-op with a registered nurse and registered dietitian. You will see the registered social worker at 6 months. Confirm whether your appointment is in person or virtual. If it is over the phone, please find a quiet space for your appointments. Please have a list of your supplements and medications readily available. We will also be providing you a lab requisition to complete blood work at the end of each of your appointments. We usually host a support group on the last Wednesday of every month. Please call the front desk to book you in if you are interested in attending. Please call the clerks if you don't know the date and time of your 3-month appointment. Their phone number is 416-242-1000, extension 23316, and complete your labs 2 weeks before your next appointment. We'll see you at your 3-month appointment. Take care until then. Things may have changed since we recorded this presentation in January 2021. If you have additional questions after this presentation, please get in touch with the clinic.